Hello everyone, my name's Ian Buckle. I'm really looking forward to talking with you at the Schein Digital Symposium in May. The topic that we're going to be discussing is the digital occlusal connection. But actually, like all things with occlusion, it's really if we can use the digital products to manage the occlusion, then that's going to make our practices more predictable, more efficient and more productive, which is really what we're looking for from anything that we use. So we're going to be talking about all sorts of different things. We're going to, from our online treatment planning module, the Dawson Diagnostic Wizard, which takes us all the way through from examination, diagnosis, two-dimensional and even up to three-dimensional treatment planning. Hopefully we're going to show you as well how maybe in the not too distant future we can try and get rid of some of these things and articulators and be doing a lot of the things that we would like to do on the articulator. We don't have to do that manual anymore, we can do it virtually. We're going to be looking at how we use our CBCT scanner in our practice. Obviously from all our implant things, we're going to use that in connection with our intraoral scanning, and then we can do a virtual wax up, and from that virtual wax up we can design where the tooth needs to go, which then drives the position of the implant. And then if we want to, we can also make a stent that's going to design where that implant needs to go or drive where that implant needs to go. So let's go through to the surgery and the treatment room, and I can show you some of the scanners that we're using on a daily basis. I've been involved with scanning for over 30 years since I was a student, and you know, obviously the main one that we've been using is CEREC. We design and mill a lot of our own stuff. We have a little furnace, and we do some staining and glazing as well. And you know, we've been doing that pretty successfully for a lot of years. I've also got involved with 3Shape as well now, which is a fabulous product. I'm using that more for the stuff that I'm working with the lab to do and some of the bigger cases. So, and that's going really, really well. Even down to the little bits and pieces that we use, like TechScan, which is our digital articulating paper, so that when we make these great restorations and beautiful implants, that we can maximize our efficiency and minimize the forces that are acting on them. So that with T-Scan, we know how the forces are acting, we know exactly what's going to happen with them, and that way we can make ourselves much more predictable. The last thing that an implant wants is lateral forces, and with T-Scan we know exactly what's happening. The last thing we want with porcelain is excessive force in any particular areas. So we'll be showing you some of those things as well. We're really looking forward to seeing you in May and hopefully show you how we use it in our practice, so that you can maybe do some of the same things to make yourself more predictable, efficient and productive.